This is a patient with a 30-year-old. Can you see my screen? Mm-hmm. Okay, so this is a 30-year-old with a history of lupus. She got an ultrasound with us, and on the ultrasound images, we do have gallbladder wall thickening and a fluid level in the gallbladder, and there is this heterogeneous material around the gallbladder, and there was no hepatitis history. And initially we were thinking just this could be, and this is a walkie-talkie patient showing up in the ER, not an ICU patient. And all this pericholecystic edema, fluid level, heterogeneous material involving the wall and in the pericholecystic region. And got a CT, non-contrast CT. And we do have a hyperdense material in the gallbladder lumen with a fluid level.
Don't see your CT, Sai.
You can't see my CT?
No, we only see the ultrasound.
Oh.
Maybe, there you go.
Now we see it.
Okay. So there is this fluid level in the gallbladder, and there is this fluid around the gallbladder with edema, and there is also heterogeneous hyperdense material in the fluid around the gallbladder as well. And looking up, and this patient was treated with steroids, and within a week, the patient's gallbladder wall thickening resolved.
Wow.
And so looking at the literature, there is an entity called lupus vasculitis associated hemorrhagic cholecystitis. And it's an type of acalculous cholecystitis that's a response to steroids and doesn't need a cholecystostomy or cholecystectomy.
And they felt confident
Awesome
giving
case.
steroids because of the clinical presentation, because the patient didn't seem septic. Is that true?
Say that again?
If they felt confident treating with steroids instead of antibiotics because it was non-tender and the patient was not septic.
Not sure why they opted for steroids. And the patient, I think the radiologist suggested cholecystitis, and immediately they made the connections in their note saying that it's a lupus-associated cholecystitis and started treating with steroids.
Kudos to the clinical provider for making that connection.
Yeah. And go back.